everyone. I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty, and today we will be studying about carditis. It is an important segment of your CVS and carditis. One short note will be asked from this topic. Not an LAQ because it is not that important that it will be asked as an LAQ. Even if it is asked as an LAQ, it will be asked in an integrated manner. So read this topic in that way only. Okay, starting. Okay, let's see what carditis is. So carditis is nothing but the inflammation of one or more layer of the heart. First tell me, what are the layers of heart you have? You have three layers: endocardium, myocardium and pericardium. You have the three layers: endo, myo and pericardium. So in the carditis, obviously I have told you, if there is a word of itis, this means there is certain inflammation which is occurring. So what happens here? See this figure, you have the pericarditis. Pericardium is the outermost layer and the covering. So there is an inflammation. Then there is endocarditis. In endocarditis, there is an accumulation of bacteria. In the myocardium, there is an involvement of the heart muscles. So let's see, we have three types. Endocarditis. What is endocarditis? Inflammation of endocardium and walls. I have told you in this diagram also. Myocarditis, inflammation of the myocardium. Pericarditis, outermost layer of the pericardial sac, there is an inflammation of that. Okay, so please read this very carefully, so it will be very beneficial for you to understand the whole chapter, because the whole chapter revolves around this only. Okay, next let's first see about the pericarditis. Now I have told you that pericardium is the outermost layer of the heart. It is the outermost layer. It is the outermost layer of the heart. So what is happening over here? The thing which is happening over here is there is an inflammation. The outer layer is getting inflamed. Why it's getting inflamed? Because there is any accumulation of the fluid which is happening. There is an accumulation of the fluid. As a result of which, what will happen now? The heart will try to compress. The heart will compress and finally cause a condition called as a cardiac tamponade. Why pericarditis? It is due to any viral infection. Maybe the person is having any kind of viral infection, maybe the uremia, or maybe any autoimmune disorders, or it can affect after the patient has gone under trauma. And for trauma, we use a very special grading system called as the triage, right? And that you will study in your surgery lectures. So it is associated with severe chest pain. See this figure, the patient will complain that, doctor, I am having a severe kind of chest pain, and there will be a lot of pain that the person will be suffering from. Okay, now let's talk about the pathogenesis that we have. So in the pathogenesis, I have classified it as endocarditis, myocarditis, pericarditis, and you also have the pancreatitis, that is nothing but the rheumatic. So let's see in general what is the pathogenesis. In the endocarditis, first there is endothelial injury. Obviously, if the name is starting from endocarditis, then the first thing that will happen is the endothelial injury. After the endothelial injury, what will happen? There will be platelet fibrin thrombus. And if you are not thorough with the acute inflammation and the chronic inflammation part, where I have explained you how the mechanism revolves around, then you have to watch the journal pathology lectures. Okay, so there is endothelial injury first, then there will be platelet and fibrin thrombus formation which will happen. After that, there will be microbial colonization. All the microbes will get accumulated. After that, it will cause vegetations, and in vegetations also you have certain types which we will see. Next you have is the myocarditis. So what happens in the myocarditis? In the myocarditis, you have a viral invasion. Okay, the person may be suffering from any sort of viral infection. After that, what happens is there is myocyte necrosis. There will be the necrosis around that, tissue, right? After that, there will be immune-mediated destruction, as a result of which there will be fibrosis of the surrounding area, right? Next you have is the pericarditis. In pericarditis, what happens is there is direct infection or the immune reaction. Nothing is external, there is just a direct infection. After the infection, there will be exudation and the fibrous thickening. There will be direct infection. After the infection, what will happen? After the infection, there will be exudation, and after the exudation there will be the thickening of the fibrous layer. Now next you have is the pancarditis, also called as the rheumatic one. Now in the rheumatic one, what is happening? There is a molecular mimicry which is occurring. After that, the autoimmune system will attack and there will be ash of bodies. This is so important, guys, that if the person is asking you about the rheumatic conditions, then the very first thing that you have to mention is the 𝗲𝗵𝗻Ⅎ body. And I have told you that there are certain things which should come to your mind when I say something. Mast cell, histamine, WBC, neutrophils, rheumatic, 𝗲𝗵𝗻 body. These three things should be very thorough and very crystal clear in your mind. Okay. Next you have is the let's talk about the endocarditis. So in the endocarditis, you have the types. What are the types you have? First one is the infective endocarditis. In the infective endocarditis, you have the acute one, which is caused by the Staph aureus. Remember the organism, because in your microbiology also they will teach you, and there you have to remember the organism. So why not just remember it here only? Remember the organism is Staph aureus. Then it is highly virulent, and previously the patient is having a normal wall which is getting degraded. Okay. Next you have is the subacute one. Then you have the non-infective endocarditis, Liebman-Shack, SLE, and non-bacterial thrombotic endocarditis. Let's just see what basically they are. See, these are the figures, right? See the first one. In the first one, what you are able to see, it is arranged in a linear fashion, right? All the vegetations are arranged in a linear fashion. They are behaving like civilians, right? And not villagers. They are behaving like civilians. So it is the RHD, the rheumatic heart disease. So what happens is there is small lesions that you are able to see. They are the small warty lesions, and the site that is affected is along the closure of the wall. Next you have second one is the infective endocarditis. In the infective endocarditis, what you are able to see, oh my god, the vegetations are large and also they are bulky, right? So they are large and bulky vegetations which you are able to see. Third thing you have is the non-bacterial thrombotic endocarditis, and here you are able to see, okay, they are not so bulky, but they are small vegetations which are there and multiple, right? So they are seen in the malignancy. DVT is nothing but the deep vein thrombosis, and you will learn in your surgery posting. If you are posted in a surgical ward now, what you can do is just go to the surgery posting and see if there is a case of DVT. Just examine that patient thoroughly. Okay. Next you have is the vegetation. So I have told you vegetations are small, single and multiple. They are along the line of closure. Fourth and last one you have is the Liebman-Shack. In the Liebman-Shack, what you are able to see, you have the small and also the medium vegetations which are there, small and the medium vegetations which are there, right? And it is not that common, it is uncommon. Okay, so endocarditis, it is of two types, acute and subacute. Vegetations basically depends on the microorganisms that the person is affected with, right? This is the atrium, and after that you have the along the AV wall, you have the vegetation. The vegetation is along the AV wall. Okay. If you are not through with the chambers of the heart, now just go and see the medicine lectures or the physiology lecture your professor has told you over there, right? Let's talk about the vegetation. So the pathology, the vegetations are febrile, bulky, and necrotic. What are the complications that can occur? There can be embolism, there can be valve destruction, and there can be ring abscess and 𝗵𝗵𝗻Ⅎ. 𝗵𝗵𝗻Ⅎ is nothing but the infection of your blood that will occur, right? So here I have shown you the figure of pathogenesis of infective endocarditis. What is happening? there is a valve abnormality or the prosthetic valve which is there. In the if a patient is having a disease related to the heart, so what we do is we place a prosthetic valve over the heart. After that, what happened now? After some time, there is thrombi and fibrin formation which will occur, and the bacteria will get accumulated through that area, and that will cause endocarditis, and finally the vegetations will occur to happen. Okay. Other can be the source of bacteria can be either the person is an IV drug user, either he can having a skin infection, either some dental procedures were done, right? And either the surgical procedures are done. So if they give you a case scenario now, they will also mention that there is a history that patient was on IV drugs, or either they can mention the dental procedure. So look that these two are basically your keywords for diagnosing a patient of infective endocarditis. Next, what are the clinicals you have? So the patient will be having fever and there will be a murmur which will be heard. Although you are in second year, I don't think so you will be able to appreciate that murmur very well, but you are able to feel certain murmurs. Okay, I know you only know two types of murmurs are there, diastolic and systolic, but there are more murmurs which are further classified, right? Then you have the hemorrhages will be there. Then there will be two lesions. There will be 𝗲𝗵𝗿𝗵 lesions and the osseous nodules and the rod spot will be there. So these are basically the 𝗲𝗵𝗿𝗵 lesions, osseous nodules and the rod spot. These are the main hero. Okay, they divert all the attention towards them because they are the main hero, obviously, right? So this is the osseous nodule and these are the 𝗲𝗵𝗿𝗵 lesions that you have. The patient will also have the splenomegaly. What is splenomegaly? It is a condition in which the spleen of that person is getting enlarged, right? What are the investigations you will order? Blood culture, first investigation that should come to your mind is blood culture. That is gold standard. Okay. Second, since it is related to the heart, you will order the echocardiography, ECG, you will order. Then you have something called as a Duke's criteria, which is very, very diagnostic of this, right? Next, what is the treatment? Treatment will be antibiotic, IV antibiotic can be given to the person, or you can give the valve replacement in severe cases. Now, see this figure. There is a poor blood flow and there is aortic valve stenosis that has happened. This is the healthy valve of a person. This is bicuspid aortic valve and this is the aortic valve stenosis. So what is happening in the bicuspid aortic valve? There is aortic valve repair, and in the aortic valve stenosis there is a surgical aortic valve replacement. We surgically replace the valve. Okay. Next we will be studying is about the myocarditis, and I have told you what is myocarditis. Myocarditis means the inflammation of the muscles of the heart, because myo means heart and itis means inflammation. Okay. What are the causes? Causes can be viral like the 𝗲𝗵𝗵𝗵𝗵, the adenovirus, or it can be bacterial. Protozoal causes are the Chagas disease. Okay, and in Chagas disease you have a very, very beautiful sign called as the Roman sign. Okay, then you have is the hypersensitivity, then is the autoimmune, in that you have the rheumatic and the SLE. Next, let's talk about the pathology. In pathology, you will be able to see the flabby and dilated heart. There will be a flabby and dilated heart which you will be able to see in the microscopy. See this microscopic figure. You are able to see intestinal inflammation is there along with the myocyte necrosis. See, here you are able to see this. These are basically the intestinal inflammation which has occurred. This is basically the intestinal inflammation which has occurred. Okay. Next, you will be able to see the hypersensitivity. There will be a lot of eosinophil cells which will be occupying it. Then you have the giant cell myocarditis. Next, what are the clinical features you have? The patient will feel a flu-like symptoms. All the flu-like symptoms the patient will present with. Then the person will have fatigue and chest pain and palpitations. I have already told you in the previous video what is palpitations, right? And you should also know that arrhythmia, there will be a irregular rhythm, heart failure, and sudden death. It is the last thing which will occur. Okay, what are the investigations you will order? First one is the ECG. In the ECG, you will be seeing the sinus tachycardia. In the ECG, you will be seeing the sinus tachycardia. And see, guys, I can't explain you the whole ECG over here, but what I can suggest you is just read it from your physiology. And earlier also I have told you that you have to study the system in an integrated manner, because when you will come to your final prof now, you will realize how important it is to study all the things in integrated manner. So first thing is, if you are studying CVS, study it from your first anatomy. In the anatomy, see the embryology part of it. Okay, then see about the blood supply of the heart. Then comes the physiology. In physiology, see the cardiac cycle. Then see the ECG part. Okay, and then come to the pathology. In the pathology, cover all the CVS part that we have read. Then lastly, go to the pharmacology section. Okay, and if something is there in the microbiology lecture, just see that also. Okay, you will be having arrhythmias, and the cardiac enzymes will be increased, like the troponin and the CKMB will be increased. And I have already told you why this cardiac enzymes are important, because they signifies the time of death that you will learn in your FMT. Okay, then you have is the endomyocardial biopsy. That is the gold standard. That is the gold standard. In MRI, you are able to see the myocardial edema and the fibrosis. Okay, so these are basically the investigations that you will order. What is the treatment? First treatment is obviously supportive. You will give the bed rest to that patient and avoid exertion. Okay, you will ask that patient that it's not needed for you to do all the work by your own. You can take help of some person, right? Second is treat the cause. Like we can use antiviral, antibiotic, and antipyretics. See, antiviral, antibiotic, antiparasitics. Okay, so these three things, you know what you have to do? You have to read it from your pharmacology lectures. Then you have is the steroids and immunosuppressants that you can give. And if the patient is severe, what we need to do? We need to do a heart transplant. Obviously, if there is a heartless person, you have to do a heart transplant of that person. Okay, bring him back to bring all the emotions back to him, right? See, it's just, I'm joking, please don't do that. Just like we see that in South movies, right? There's a heart transplant that they do. Next you have is the pericarditis. There are two types, acute and the chronic one. Acute one is obviously of shorter duration, chronic one is of longer duration. What is the pathology behind it? You have the fibrous pericarditis. You will be able to see a bread and butter appearance. See this bread and butter appearance? See, this is basically your bread and butter appearance. So from the next time, whenever you are consuming bread and butter, just think about this condition, so you will remember it in a better way. Then you have is the constructive. In the constructive, you have the fibrotic and calcified pericardium, that is also called as a armor heart. Okay, what are the clinical features you have? In the clinical features, the patient will have a severe chest pain. It will be sharp, rhitic, better on sitting forward. Okay, the patient will say that I feel like someone is pricking, right? Then there will be pleuritic pain, and the person will say, when I bend forward like this, the pain is subside. The pain, I am not able to feel the pain. Okay, pain. What you have to do next thing, whenever you are going to your medicine posting, just read what are the characteristics of pain you have, right? Because in your second year now, what you think is just history is being taught to you, but history taking is so important, guys. Please emphasize on history taking, and if and whenever you get a chance to take a history, please take a history in a proper format. Okay, next you will be able to see a pericardial frictional rub. Pericardial frictional rub. In the heart, you will be able to see a muffled heart sound. Okay, whenever you are examining that patient with the help of an stethoscope and you are hearing the sound, you are able to see a muffled heart sound. And you know what? There is a cardiac tamponade that we have discussed above. It has a Beck triad. What is Beck triad? See, it is also important. It can be asked as an MCQ. Okay, so what is Beck triad? Beck triad is nothing but the decreased BP, that is the hypotension, muffled heart sound, and raised JVP. See, now also you have got a new topic to read, that is the JVP. And JVP has how many waves? Tell me, right? And if you don't know, just read JVP portion. So I guess we are done with this, right? Next thing that we will be studying is about the summary, because summary is very, very important, and one day before your exams only summary will come to your rescue. Let's see what we have in the summary. In the summary you have, first one is the feature, then about the endocarditis, myocarditis and pericarditis, because they are the main heroes, right? We have three kind of carditis: endo, peri, myo. Okay. What is the main cause of endocarditis? Bacterial. Main cause of myocarditis? Virus. Main cause of pericarditis? Viral or autoimmune. Key lesions, what are there? In endocarditis, we have seen that there were vegetations. Okay. In the myocarditis, you are able to see myocytes and the necrosis. In the pericarditis, fibrin and fluid and fibrosis. Okay. FFF. Right. What are the clinical hallmarks? In endocarditis, you have fever, murmur and emboli. In the myocarditis, you have arrhythmia, heart failure, sudden death. Pericarditis, chest pain, pericardial rub, effusion. Investigations, blood culture and echo. In endocarditis. In myocarditis, you will order biopsy and MRI. In pericarditis, you will order ECG plus echo. And for the treatment in endocarditis, IV antibiotics and surgery, valve replacement surgery that you have to give. In the myocarditis, you will give the supportive treatment and the specific kind of therapy, that whatever the infection that the person is suffering from, we will give a specific treatment to him. Pericarditis. In the pericarditis, you will give the NSAIDs. What are NSAIDs? And steroids, and the drainage will be done, right? So this is all about the carditis portion. Now we are good to go. Will be now solving certain questions, right? We are now solving some questions. I think now be solving some questions. The first question, although the answers are mentioned, so there is a 25-year-old IV drug user. Okay, I have already told you, they will give you this in your case scenario, IV drug user. Okay, there is a IV drug user, which is a very important hint in your question. He presents with fever, chills and new onset pansystolic murmur at left lower sternal border. Which organism is responsible for this? It is a case of infective endocarditis, and which organism is responsible? It is the Staphylococcus aureus. S. aureus is responsible. Next, what is the pathognomic feature of rheumatic carditis? It is the 𝗲𝗃 body. It is the 𝗲𝗃 body, right? So guys, this was all about the carditis portion you have. It will be asked as a short note only and not as a long question. Okay, I hope I made myself very, very clear. And if you are having any kind of doubt, feel free to reach me, feel free to DM me. I will answer all your doubts. Okay, thank you.